Are you a rising D3 dental student trying to figure out what this next year is going to be like? Stay tuned as we talk to a rising D4 who just finished his D3 year and has all the secrets, all the tips. Stay tuned. Hi, this is Dr. Darwin, a new dentist coach with another episode of Ask Dr. Darwin on the New Dentist podcast show, where you learn about getting into dental school, surviving dental school, getting into residency, and then life as a new dentist. Be sure that you subscribe down below here on the YouTube page, Dr. Darwin Speaks, and also hit the notifications as well, so that way you don't miss any of the videos that come out on a weekly basis. Looking forward to having you learn from all about 200, close to 300 videos that we have that are there just for you. Today for you, we have upcoming rising D4 student Dr. Jeremy Ho, who's going to share with us how he survived the D3 year. So what's going on, Doc?
I'm doing great, Dr. Darwin. How are you?
I'm doing great. Probably not as good as you now that you finished that D3 year, man.
That's right. That's right.
That's awesome. Awesome. So just for those that may have not seen you in some of our other videos, just please introduce yourself, where you're from, and what school you're at as well.
So, hey, everyone. I'm Jeremy. As Dr. Darwin said, I'm a rising D4. So I'm actually up north from Canada at the University of Toronto. And yeah, just happy to get my D3 year out of the way.
That's great, man. I remember when you were starting school. Oh my God, time is going by fast. Probably not fast enough for you though, I'm sure.
Oh man, I wish I could graduate by now, but you know,
it's coming.
One more year to go.
It's coming. You're 75% done now, man. So you know, now you see light. You can see light at the tunnel.
Oh, I can for sure.
That's good. So tell us a little bit about what you heard about the D3 year before you got started, from friends or the classmates. What did you hear?
Yeah, I have a lot of friends in upper year, actually. Now they're D4. They're almost, well, I guess they're done. They're graduating. And before I started D3, I remember talking to them, and they're just telling me, smile on their face, saying, it's going to be a rough year. I remember being like, what do you mean it's going to be a rough year? I thought second year was really pretty bad. And he said, no. Third year is the worst year in our whole program. And a lot of it is the combination of all the didactic. It gets really heavy didactically in the second half of second year. And then in D3, you have that course load, and then you have to start seeing patients. So it's that transition from pre-clinic to clinic. And granted, in D2, we started seeing a few patients for hygiene. So we kind of got used to a little bit of our computer program, which is Axiom, to see patients and have our own roster and book them in and have our own chair and see them for appointments. But in D3, you start doing other work. You don't just do scaling anymore. You have to start doing perio exams, new exams, restorative work, prosthodontic work, etc. And so just the ins and outs of clinic, they get more complicated. The courses don't get any easier, and the course load is actually significantly more. A lot of the courses are in specialties now, so we have our own endodontic class, perio class, ortho class, and so forth. And then in third year, what makes it also really difficult is our scheduling. So usually we have classes from 8 to 5. And what happens is our typical day schedule is like 8 to 9:30, we've got a class. And then 9:30 to 12:30, we have clinic. Then we might have like 12:30 to 2 is lunch, and then 2 to 5 is clinic. But on some days of the week, we might have lunch only from 12:30 to 1, and we'll have another class from 1 to 2 before we go to clinic 2 to 5. And a couple of reasons why this is difficult is because getting up at 8 a.m. to go to class at 8 a.m. is really difficult. I personally commute, so I commute about 45 minutes. So I got to wake up extra early, try to save some money, that's why. And then not only that, but the problem is that if you have a patient that's coming in for a 9:30 appointment, they're going to be seated at 9:45. And it does take about 15-30 minutes to set up a chair. I'm sure every dental student knows this if they're in clinic. It takes a long time to set up your chair, order everything you need. get everything from the dispensary, and set up your chair before your patient comes so you look nice and professional and ready for the appointment. That means you got to leave your class early to do that. And that could be disruptive to the class, and, you know, then rinse and repeat for the class after lunch. And so you maybe only have a half-hour lunch, then you're racing to class, and you have to leave class early to set up for afternoon. And so it becomes quite difficult and stressful for a lot of people. The other thing is, at University of Toronto, I'm sure like a lot of other dental schools, you do a lot of your own lab work. So whether it's doing your own pour-ups and wax-ups and et cetera, mounting for your cast for partials and for crowns and et cetera, you have to do all the lab work. And so when you do all the lab work, you do it after school, right? So you're not done at the end of the day at 5 o'clock. I wish I was done at the end of the day at 5 o'clock, but you know, you're staying behind 6 o'clock, 7 o'clock. I've been at school until 8 o'clock, and you still have other commitments, and you still have other things you have to do, like studying. And I do a lot of extracurriculars. I'm in student government. I do research, etc. So D3 has been that transition has been quite difficult overall.
Yeah, so it sounds like it definitely has some challenges based on not only what you heard about the D3 year, but what you actually experienced over that period of time. Tell us a little bit about what you liked most about D3 year.
I think what was really gratifying about D3 year is finally seeing your patients and finally being able to say, hey, like all the stuff I've learned in class, all the didactic I'm starting to, and all the preclinical, all the sim clinic is finally translating to chair side. And being able to say, hey, I know how to look at this x-ray. I know, what the treatment plan needs to be and how to take care of this patient. I've always looked forward to the part of just getting to know my patients and building a good relationship and rapport. I have fun in the chair. I think that's the most important part of dentistry. It's not just about studying. It's not just about teeth. It's about getting to know your patient, getting to know them as a person, as a whole, and listening to their stories. And I find that's the most gratifying part, because after all the stress of studying and needing to know everything and doing well in school, it's seeing the patient and getting them to not be so scared about dentistry, getting them from, their dentition not being so great to being a better place. Like that really warms my heart. And that's probably my favorite part of D3 for sure.
That's good. That's good. Challenges. I know you mentioned, the notion of your commute as it relates to classes, as it relates to being in class and having shorter period of time to eat, or maybe transition to the clinic and preparing for your clinical patients. What other challenges are present in that D3 year?
I think in D3, I mean, as much as the school does try to help you transition to clinic, there's a lot of different steps, even like navigating Axiom, which is our computer program for patients, or even how to set up your appointments, or what do you do in each appointment. A lot of that, there's a lot of confusion. And a big part of it is because it's our first time being in clinic and dealing with much more complicated treatment. And so we really rely on our D4 friends. Actually, back in D1, we have this program called the Big SIB program. Essentially, you get paired up with a D2. And I found that really helpful for me, because having some D4 friends, including my Big SIB, reaching out to them, asking them questions, we had a chance to actually speak to them in clinic and just get a lot of our questions out of the way. I thought that was really helpful. There's a lot of paperwork as well that's really challenging. Before you ever see a patient in clinic, there's a lot of things you have to consider in terms of their medical health. So we have to do certain consults with different professors, medical consults, anesthesia consults. And these are usually done so that we know if they have diabetes or if they have some other conditions, how to take care of them if there's a medical emergency in the chair. And so you have to do all these different steps. You have to fill out all this paperwork and really get to know your patients and book them in and make sure everything's okay before you can even touch them or even look at their teeth. So I feel like as much as the school really tries to help us transition into clinic, there's a lot of stuff you learn as you kind of proceed, and you will make some mistakes. You will look like a deer in headlights sometimes, and you don't know how to, book certain things or know who to speak to for help and etc. But you kind of learn along the way. And so by the time you're in second semester of D3, you get a bit more comfortable in clinic. But that first semester, when really everything's coming to at the same time, that's when it gets really overwhelming and challenging.
Yeah. Well, looks like you've been able to overcome some of those challenges and had some good experiences. What advice would you give for all the second years that are now transitioning into the D3 year? What's some advice that you would give them, knowing what you know now?
It's going to be a lot of work, first of all, but it's going to be really rewarding. There will be many times that you'll feel a lot of stress, a lot of pressure, and you don't know if you're doing something right. I feel like myself and my classmates definitely felt that that uncertainty of are we taking care of the patient the right way? Are we doing things the right way? And sometimes not having the entire confidence that we're doing things properly in clinic. But don't worry, it's a part of the process. Really reach out to your upper year friends, even your big sib, etc., and just ask them questions. None of us judge because we've been in your shoes.
Right.
And just take it day by day. I feel like in clinic, there's just so many things going on, and there's just so much happening that you just have to enjoy the moment and understand that you're here to learn. You're here to be a student. You will make mistakes. You can ask silly questions. There's no stupid questions. And just enjoy it. I mean, you only get to do D3 once, even though it's a tough year.
That's the only one time is all you want to be doing it too.
There are growing pains. Everyone who's gone through D3 knows, but it's a very rewarding time. I really enjoyed it, and I know that anyone going into D3 will as well. But just take it a step at a time, and everything will come together. It just takes some time, but it'll be great in the end.
That's good. That's good. So tell us a little bit, now that you're transitioning to the D4 year. You've got about 365 days left of your dental training, or at least your first phase of dental training. What are some of your plans that you're going to be working on for this D4 year?
Yeah, it's a great question. I think what's on my mind is residency. I feel like making good grades in the first 3 years and just doing lots of research and getting to know faculty, etc. Really reaching out and figuring out what my interests are. I want to pursue orthodontics. I think that's my calling. And so I think a bulk of my D4 years applying to orthodontics, backing up with some GPR. I think GPR is also going to be a great option. If I don't get into orthodontics the first time, I think doing a hospital residency would be great for me, be an asset moving forward to do specialty in the future. So I think the bulk of it is applications. If I'm lucky, get some interviews and prepare for interviews, do them. If I'm lucky, then maybe match somewhere, and then just finish up my clinical credits and finish up and pass my board exams, hopefully, and get my license, and then move on to residency.
Yeah, that's right. That sounds like a good plan. Just keep in mind during this D4 year as you're transitioning, especially for ortho, those applications go in early. Ortho and endo, early. So I already know you're already on it, but just word to the wise for others that are listening, thinking about ortho during their D3 or during the D4 year. Applications now, get on it, submit them, because as soon as that portal opens up, a lot of the ortho program directors, they want whoever has submitted through that first wave of applications. Those are the people that they're looking at. And if you're late to submit, you'll be late to get into ortho. It's just that easy. So that's great, man. I got some great plans. So again, we thank you so much for sharing this survival checklist of how to get through D3 year. If you guys are listening and watching, if you like what you've heard, or if you have some additional comments, be sure to shoot them down below right here at newdentistcoach@gmail.com. newdentistcoach@gmail.com. Student Dr. Jeremy, also, what's the best way for people to get in contact with you if they have questions?
Just send me an email, jeremykc.ho@mail.utoronto.ca. One more time, jeremykc.ho@mail.utoronto.ca. I check my email all the time, so I'm happy to help. Someone did reach out to me recently, and I was happy to give him a nice talk, and he was very excited. So he's a pre-dent, and I'm happy to help anyone. And just like how Dr. Darwin's helping me, I'm happy to help anyone as well.
That's great, man. Well, again, you've helped all those that are listening and watching right now, so we appreciate you. We're going to keep our fingers crossed. Well, don't wish you good luck. It's not luck that you've been so successful these last 3 years. It's due to preparation and determination. So we're going to say continued success continued success for this D4 year. If I could be of any help as you get ready to apply for ortho, let me know. And for you all that are watching, check out this next video right here. I think it's right here. I don't know if it's here. It's here. One of these two places. Check out this next video about ortho, and hopefully that helps. Student Dr. Jeremy, good luck. D4 year. It's time to go. Class of 2021. Let's go. Take care.
You too.